And our 8:30 High Beam this morning, Talk with the Doc with Dr. Tim McKnight, who's in the studio with us as usual. Good morning. Glad you made it through the fog. And
Thank you.
Made it through here. So this morning we wanted to talk about blood clots, and that seems a serious subject because I don't know how they form, but I know that they can do some serious damage.
Yeah, there's two kinds of blood clots. There's arterial blood clots that cause strokes and heart attacks, and then there's clots in the veins. And that's really the topic today, the deep venous clots. We call them DVTs, the deep venous thrombosis. And the danger with those is that they typically form in the legs, sometimes in the arms. But when they break off and go to the heart will then pump it to the lungs. And that's an acute chest pain, short of breath. It can be life-threatening. I mean, you can drop and die pretty quickly from that. So that's the real danger from those. So they're pretty common, and there are certain people that are more predisposed to these clots. The obese, those who are sitting for long periods of time, particularly on a plane or in a car. So being immobile after a surgery when you're laying in bed, that can put you at risk. There are certain people that have predisposing clotting problems that can also be at risk for those. So those, and then birth control pills also can do it. So there's some other risk factors, but again, the problem is there's danger if it's not taken care of and not identified quickly and then treated appropriately.
So these deep from the veins,
right,
that is returning to the heart, correct?
It's returning to the heart, and the blood flow returning to the heart is really slow. And if we slow it down too much, just think of what happens if you're in a plane and you're cramped into this seat and your knees are bent and you're not using your muscles to kind of push some of that blood back to the heart. It just sort of sits there. And if you have any underlying conditions that make that, or injury to the blood vessel lining, that makes it more likely to clot. So that's why we tell people when you're in a plane, get up and walk around when you can. And if you're driving, don't be this person that drives 5 or 6 hours without a stop. Get out every hour or two and take a short walk. Stretch your legs out. So again, it's something typically people will come in and they'll have pain and swelling in their calf or in their leg, and they may have redness and tenderness, and that will prompt them to say, did I pull a muscle? Is something wrong? And when we see that, we usually are thinking, this could be a blood clot, and we can get an ultrasound, which is a very easy way to see. With the ultrasound, you can often see the clot in the vein, but the vein is very compressible, so sometimes we can't see the clot, but if we push the ultrasound probe down and we can't compress that vein, we assume there's a clot in there. Mm. And the clot in the leg is not life-threatening. It's when that clot, a piece of it breaks off and goes to the heart. So we use blood thinners to prevent the clot from continuing to grow, where it can easily break off and go to the heart and then the lungs.
So this blood clot is all of the cells of the blood, or what is clotting? It's
the platelets that form the clots. That's a protective mechanism for us. If we cut ourselves shaving or whatever we're doing, we need to be able to clot the blood. This is an inappropriate clot that gets too big and it obstructs the blood flow back to the heart. And so if you have recurrent clots in your legs and you can't get the blood back, then everything downstream from from the calf or wherever the clot is down to the foot, that vein has no place to put the blood. The blood keeps coming in it, but it's got nowhere to go. So the vein will swell, the blood in the vein will start to leak out, at least the lymphatic or the plasma will leak out in the surrounding tissues, and then you have chronic swelling. So after that clot is gone, you have persistent swelling because the veins are now stretched and swollen and the valves don't close tight, and they leak the plasma of the blood out into the surrounding tissue. So that could be chronic swelling in one leg. That's one of the complications or side effects of a clot.
So blood thinner is used. If this is not fully effective, is there surgery involved then with the veins?
There can be. Sometimes we can go in and actually retrieve the clot, but for people that continue to have these clots, we can put we call it an umbrella. We can put like a screen in the inferior vena cava, which is the main vein that's going right back to the heart, and we can put a screen in there, strategically placed, so that if the clot breaks off, it can't get to the heart. And often those are a temporary placement until we get good control of the situation. But again, those pulmonary embolisms, or the clots that go to the lungs, those are life-threatening. Sometimes they're little tiny clots that we call them shower emboli. They just little clots everywhere in the lung. That makes you short of breath with exertion, gives you chest pain, especially when you breathe deep. But if it's a huge clot that completely obstructs the flow to that lung, that's a saddle embolism, and it can be life-threatening. It's got to be dealt with right away.
What are prevention measures? Being in good shape is going to help, I guess.
Absolutely, yes. So not being obese, staying active, and then trying to avoid those risk factors. But if you've got a clotting issue in your family, you need to be checked out to make sure you don't have a genetic predisposition to clot inappropriately. And there's many tests. Factor V Leiden is a real common deficiency that causes that. These people need to be on some kind of a blood thinner. It's usually something like Xarelto, Eliquis. Sometimes it's Coumadin. But again, they're life-threatening problems if you don't know they're happening. Aspirin sometimes is a good therapy also. It's not quite as good as some of the other drugs that we use for these clots, but it can be a fairly good preventive measure if you don't have risk factors for bleeding and other potential problems with aspirin. So again, it's really common, and we need to be really cautious and careful that we don't let this extend into something that could be more severe.
All right. I don't know what else to question about that other than the blood thinner. You mentioned the aspirin could cause other bleeding problems. I guess you would have to be careful with that as well, right?
Right. And the thing that people will say, so what happens with the clot is are the blood thinners dissolving the clot? No, they don't dissolve the clot. The body dissolves the clot in time. The blood thinners prevent the clot from growing, getting bigger and bigger and more fragile, more likely to break off. So one of the tests that we can do if there's a low index of suspicion of a potential clot, we can do a blood test, and this blood test is called a D-dimer. If the D-dimer is elevated, it suggests there may be a clot and that we need to go do the ultrasound. But if it's a normal value, then we're sure there's no blood clot and we don't have to go any further. So there is a simple screening tool that we can do. But again, it's common. Surgeries predispose you to it. Age, the older you get, the more likely you are to have this. And I mentioned the clotting conditions. Pregnancy is another pretty high risk factor for this. So, again, the preventive things are just staying active and being aware that if something begins to swell and hurt in your leg or your arm, don't blow that off. Just have it checked out. Let's make sure there's not something in there that we need to know about.
Yeah, you said primarily leg, but it could happen in the arm as well.
It can happen in the arm. So the lower part of the arm would swell and be painful, and that should alert you that something isn't right and you need to be checked out.
As always, you can ask your primary care physician.
That's what we're here for.
What is this?
Yeah, that's what we're here for. We are here to help you with these problems, and you should begin with your primary care provider. We're pretty skilled at having a high index of suspicion for those things. We always, we're taught that when we see somebody with a condition, the first thing is let's make sure this isn't serious. So it's not like we're being negative and pessimistic. It's we're thinking what could potentially threaten someone's life. Let's make sure that that's okay. If you've got chest pain, it could be a pulled muscle, but what if it's a heart attack or if it's a pulmonary embolism? We have to start with those things first and rule those out. That's the way we're trained, and then we can come back to the other less serious conditions. But
you have to start at the top.
Yeah, you do, because it could be, obviously life-threatening. There's the most serious, the most common, the most interesting, but that's the way a well-trained mind in medicine thinks, and we want to protect people and save their lives.
All right, so we'll try to stay away from blood clots. Are we going to talk about the arterial kind at some point?
Sure, we can talk about arterial, completely different mechanism and some different treatments, but those are the ones that the stroke and the heart attack, those scare people, and they should, because those can be life-ending or just completely change your life. And so that's a really important topic that we should address.
All right, we'll do that sometime. Thanks, Dr. McKnight, as always.
Welcome.